I'm sure you're trying to figure out who is Lauren Toomer and why are we talking about art within a medical context. I literally ask myself that every single day because I lecture in the Department of Art and Art History as well as clinical anatomy, and then I tiptoe in anesthesia every spring and winter quarter. My whole goal as an artist is this idea of how do we truly see people and how do we encourage others to do the same. I thought it was a very interesting point. I think we keep making this point about empathy, how like the AI person was more empathetic than just the example. Because I would imagine all of you, your answers would have been beautiful. They would have been empathetic. I would have been very appreciative of what I received. So in a kind of a nutshell, what I'm after as a lecturer here at Stanford is to be working with medical students, graduate students, undergrads, so that it's not just thinking about how do we train AI to be empathetic, but how do we train people to be empathetic? Because at the other side of that, we're dealing with human beings, we're dealing with life. So again, within my kind of world, that's what we'll be exploring today, specifically a project that I work on in addition to my lecturing appointments. I have the huge pleasure of working as the Associate Director of Medicine in the Muse with one of the most incredible physicians, Dr. Bryant Lin, who's our director. If anyone needs proof of why humanities is important, go speak to Dr. Bryant Lin because he's a beautiful example of encompassing many aspects of that. The project that I am going to discuss, however, is the portrait project. I was brought in by Dr. Lin to think about ways of integrating AI and integrating art within the patient setting. One of our incredible supporters of it, who's a DCI fellow, Skip Victor, also had this idea of how do we directly engage with patients in a very, direct and personal way. So kind of in a nutshell, what this project is about a person sitting with another person and making art. We either use traditional art or we use AI as a means for being able to express what they're going through. It's not art therapy, because I know all of you are thinking, oh, art therapy. It's not art therapy. It's really just about being human. Anyone can do this. And the beauty of being able to have AI is that it opens up the door for not just artists to be able to pursue these types of worlds, but anyone who has a laptop in front of them. So yes, in terms of like looking through and thinking, we do start and have traditional pieces. We go literally like if you think right now there are people at Stanford Hospital who some of them are suffering, but they're all going through something right now as we're in this very room. How do we bring a sense of the human kind of interaction to them, and we use art as that means? I'm a traditionally trained artist. So when they came to me with this idea of using AI, I know I'm in the wrong crowd, but I was like, oh my God. Like AI, not something else that has to deal with numbers and figures. I'm trying to flip the script and bring, like, again, people, like, oh my God, feelings. Oh, can we talk about feelings in this room? Oh my God, the right side of our brain, we do have two hemispheres. How do we engage in this type of thinking? However, as I was working on this, I probably learned equally as much as hopefully the patients learned themselves. This is a first image done by one of our first patients at part of this project. We do it at bedside. We can spend up to about 2 hours with them. Sometimes it's less, sometimes it's more. This is actually a traditional piece. I'm sure you can probably tell AI did not do this work of art. However, this person who was doing it was suffering from dementia. And so I met with them twice, and each time, again, they didn't really remember the process that happened before. They also had a chronic cough, and all of these things were occurring. During the process, I kid you not, as he was engaging in the art making, his cough went away. Just stopped. And then a nurse comes in, and it throws him off, and then he starts to cough again. So yes, this research looks at the quantitative data, but those little aspects, as I'm sure all of you have witnessed at times, that's impactful. To me, again, I'm a bad art researcher because I'm like, that's it, that's all you need to see. We just need to record that, you know? Why do we need all the data and the science? Just come shadow me, people, shadow me. So as we are working together, I can either create a piece for them, they could create a piece for themselves, or we can use AI to generate something. So this person started off by making a piece for themselves, and so they were like, oh, they had a little sketch pad, so they asked me to join in. I said, sure. So I was doodling on his sketch pad. He turned to me, he says, you should look into art. I said, thank you, I will. And so he said, oh, but like, do we have a reference? What can we do? So I said, yes, we do. We can generate you an image. So tell me about what are you envisioning? So he talked about a tree. He talked about like golden tones, warmth, the natural environment. And this in the center was that image that this person created. Again, as you look at these images, these aren't just images. These are experiences of people's lives. We call it the portrait project because the portrait encompasses many aspects of an individual. It's about capturing who they are. And for me, looking at this, again, I don't just see a tree, but I see the person that I sat with. And this AI-generated image allowed for that. The next image I'm going to show you, again, AI-generated. Is that scary? I was expecting like a, so this was a very serious piece because I again sat with this woman, and she said that she had experienced a car crash. A car had literally hit her, and she didn't remember what had happened. And so I said, well, are you comfortable possibly giving me the adjectives and the words that you're feeling or that you felt before or after? And we can put it into, we use Midjourney's Discord, into the laptop, into the AI system to try to capture it. So she said, like, it was dark, it felt like it was raining, bright lights on the side of the road. And so it generates about 4 images, and this is the one when as soon as she saw it, she's like, that's it. That's how I felt. This is what's happened to me. And at that moment, I was like, I still have a lot to learn because this AI-generated image touched upon something that was extremely significant to her that she couldn't even express herself. But this image was able to do that. That's what visuals can do. As I worked with this individual, ta-da! Meet Banksy. So she had a lot of different names for this dog that she was hoping to get after she left the hospital. So she went through the list, and when she said Banksy, for those of you who don't know, is a famous living artist, I was like, you have to name it Banksy. And she's like, oh, I want to think about beach, I want to think about my dog, I want to get a corgi, it's going to be a puppy. And we put it again into the image. And this is what we got. Again, thank you. Look at the before and after. That's one single session within 2 hours at bedside at Stanford Hospital. Again, to the point that one of my fellow speakers made, this is what Stanford is good at. It brings someone like me, someone obsessed with art and who loves medicine and anatomy, and gives us a place to utilize those innovative means of expression and creation. This is the final piece that she made, and again, just shows you the trajectory. So 2 AI, 1 traditional. I'll leave you with these final slides. And again, as you look at them, again, I hope you think about not just cool AI images, but at the other side of this, just like the other side of your work, the other side of your numbers, the other side of your statistics, they're people. It's not just an image, it's a life. So as you go about in your days today and as you go about in your work, how might, thinking about who's on the other side and maybe even about how art might be used as a vessel of hope, how AI can be thought of in very innovative ways as also being a vessel of hope in and of itself. Thank you. I leave you with Banksy. A huge pleasure.